I'm Lindsey Levenson. Like she said, I'm an LMFT. What that means is a licensed marriage and family therapist. So I provide therapy, both individual and family therapy. Here on the Central Coast, I have a private practice where I do that. I'm also a cancer survivor myself, and we'll get into a little bit more of my story, but that has really morphed the work that I do. And after my cancer diagnosis and transition really into the survivorship phase, my passion for working with cancer patients really began. And so I do a lot of that in my work in my private practice, and over the years have done work with Hearst Cancer Center, as well as cancer support community in North County. So it's really something I feel passionate about because I have this intersection of my own professional knowledge about mental health, but then also my own personal experience with cancer myself. So as I started to think about survivorship and what to talk about and what that means, it seemed like there's different phases within the journey that is cancer. And when you get your diagnosis and initial treatment plan, you're kind of in this phase of I'll do whatever it takes to survive. And they throw a treatment plan at you and you're like, yes, I will do it. Maybe I don't want to do all the things involved in this, but I'll do it. It's more of a kind of fight mode, an action mode. And survivorship, since it goes on beyond that, is, what I thought of as sort of like this phase of, oh my God, this is my life now. Now I have to adjust to both the fact that I've had this diagnosis, as well as, all the treatments that I've undergone and how that's affected me, both physically, mentally, and emotionally. So kind of shifts a little bit. Okay, so this is what I'm hoping to cover in the time that I have. If somebody could keep me on time so they don't go over. A little bit about my story, what the heck is survivorship anyway, different aspects of survivorship that I've been aware of through my own personal experience, as well as working with cancer patients. And then I like to talk about coping if there's time, because it's well and good to talk about all the challenges and all the problems, but I think it's really helpful to know what to do. So hoping to touch on that as well. Okay, a little bit about my story. There's me in all my bald glory. Many years ago, when I was first diagnosed at 32 years old with an aggressive form of breast cancer, had a 1-year-old child at the time, and started to undergo treatment for breast cancer, which included chemotherapy. I had a lumpectomy, radiation, and then thought I was transitioning into, what I was hoping, how do I incorporate this experience into my life and move on? And 2.5 years later was diagnosed with breast cancer in the other breast, and kind of went through the whole rigmarole again. Chemotherapy, I had a bilateral mastectomy, I had reconstructive surgery. So again, in that active phase of treatment. And since then, that was I was first diagnosed in 2012, diagnosed again 2015. So it's been about 9 years for me in the survivorship, what I consider for myself is survivorship phase. Yes, and yay for that. 9 years, very thankful. And it's been a process is what I'll say, that it's been, when I think about it, like an unfolding of what does this mean for me, that it hasn't been clear, and that as I go through things and as I continue to live my life, the impact of these things starts to unfold in a way that I didn't really know or anticipate when I was first diagnosed. Okay, so what I thought originally, and I think a lot of people feel, what is survivorship? What you think you're going to do is get back to normal. Back to normal. All right, let me do all of these things and let me get back to normal. How do I get some kind of element of my old life back, my old self, who I was, how I was? How can I, if I'm lucky to exist in this category where treatment is behind me, how can I package it up and make it work? Or if you're not, how do you kind of move forward knowing that this is the reality of ongoing treatment? But back to normal, what are the parts of myself I get back? And what really happens is a little bit different from that. There's living with fear. Cancer isn't something that you just have and then poof, it's gone and you never think about it again. So living with the fear of it, whether you have no evidence of disease or even with a metastatic diagnosis, is it spreading? Is it progressing? So managing fear and ongoingly, over the years. And I think that it kind of ebbs and flows. Some days it's in the forefront of your mind and you're thinking about it a lot. Some days it's in the back of your mind. not quite as much, but it's always kind of hovering there and figuring out how to manage that. How do we manage the fear? It's a scary thing. Worrying about every symptom. I'm sure people can relate to that. You know, oh my gosh, my back is hurting. What the heck is that? Oh, I have a cough. What is that? Really being hyper vigilant about any type of physical symptom. And you know, this has happened to me over the years. I remember I had a back injury, I think it was. It just hurt my back. And I couldn't, you know, for like a day, I couldn't walk. I was in bed and was in so much pain. And it was amazing to me in retrospect how quick my mind went to, oh my God, it's cancer. Oh my God, this is it. I'm not going to be able to walk again. This is how it's going to end. Just like that, just in the blink of an eye. And a day later, I was feeling better. I had scans. It didn't turn out to be any cancer. But amazing how that, you know, one symptom, one little thing can kind of put you back into that place of fear and anxiety. You're going to continue to have follow-up appointments and scans. So this makes it hard to package, put it away, because you continue to be reminded that cancer has impacted your life. You continue to go to appointments. You continue to have to prepare for scans, to wait for the results of scans. So you're frequently being reminded of what's happening. And like I said, I'm 9 years out. So I've had a lot of scans and a lot of doctor's appointments. I'm really familiar with that environment. And every time I think, you know, that I'm cool, calm, cool, and collected, fine, I'm going to go to that. It's just a follow-up appointment. No big deal. I'm going to get that scan. You know, I've had scans before. It's okay. But my body remembers. My body is anxious when I walk into that office. My heart is beating. I'm sweating. I'm breathing shallow. My body is escalated because it remembers what's happened to me and what this office means. So really, like, how do you cope with that? You know, learning how to manage that. And like I said, forever. This isn't, you know, you have a follow-up appointment for a year and then you're done. You know, you're going to be monitored because you want to be monitored. You want to have those follow-up appointments. You want to have scans to see what's going on, but you know, it's ongoing. Don't get to package it up and put it away. Dealing with side effects is another reality of survivorship. Really, many side effects, mental side effects, emotional side effects, physical side effects, whether that's from the diagnosis itself or from the treatments that you've undergone. So the reality of dealing with side effects. I've had chemo brain for 9+ years. And it continues. It just happened today in my office with a client. I was trying to think of the word vicarious, which is a little bit of a complicated word, but I couldn't find it. It just wasn't there. And that happens, I would say, probably once a week still. So I've really had to learn to adapt to this is how my brain works. It works differently than it did before. So I frequently in appointments will say, I can't find that word. I can't think of it. And I've learned to kind of talk around it. What I'm trying to say is this, and what I mean is this. And it works, but it sure is frustrating, you know, to continue to have to work with that. And I prided myself on really being sharp, you know, had really good language skills. I was articulate. So it was a change for me trying to adapt to that particular side effect. And there's others too. The other thing I put in there is a new sense of identity, which connects to what I was just saying about, you know, I was really verbal, really, you know, thought I was sharp and articulate. Oh my gosh, am I that anymore? Really trying to figure out who you are in this new body, in this new reality is a challenge as well. So a lot different than what I thought it was going to be. And like I said, it's been revealing itself over the years as I continue to do these things. Oh my gosh, this is still affecting me. How do I manage it? Shannon, director of Hearst, actually sent this to me ages ago, and I just love it. I share with people all the time because it's so true that this is what you think it's going to look like, and the reality is so much different. Ups and downs, and it weaves and it bobs, and it's, you know, left and right, and you don't always know what to expect. The important thing is that the trajectory is still, you know, it's still up. But I think we expect, you know, how this is going to just improve on this trajectory, and it doesn't. You're adapting and you're learning. So I really appreciated that. Okay, some of the aspects of survivorship that I think are important to talk about, both for me and for all of you, things that you're coping with. Physical side effects, I talked about chemo brain for me, but there's so many others. Fatigue is one that I hear all the time. I'm just so tired. I don't know why I'm so tired. I continue to be tired. I just walk a little and I have to rest. I used to be able to do this. I used to be able to do that. Now I can't. It's really frustrating. Scars, I have scars. Port scars. I've got scars across both of my breasts. I have missing body parts. I had a mastectomy, so I have no nipples, no areolas. I have just, you know, reconstructed mounds of flesh that look a little bit like breasts. So adapting to that. And in the beginning, it really was, I'll do whatever I have to do. You know, who cares? Who cares about hair? Who cares about breasts? Like, I just want to be alive and I want to be with my children. But you know, now it's 9 years without breasts, 10, 15, 20, hopefully 30 years with no, 50. That's a long time to not have breasts as a woman. And you have to, there's many times that that comes up in my life when I'm with my friends, when I'm with my husband, when I'm with myself. And you don't really realize, you know, the impact until you start walking down this road, adapting to missing body parts. And it might, you know, it's breasts for me, but it could be other parts for other people. Including internal organs, you know, that you're missing or having to adapt to not having access to in the same way. I had my ovaries and my fallopian tubes removed as well. So coping with that, menopause changes. I don't have estrogen now. How do I live like that? So many things. Emotional side effects. I put PTSD up there because cancer is a trauma. It's a threat to your life or the life of someone that you love. That's considered a trauma. And many of the things that I see in my practice and for myself are symptoms of trauma, of PTSD, not necessarily like full blown PTSD for everybody, but symptoms of it that people are coping with or don't always know it's what's happening. So an example would be when I was talking about going into the office and my body was activated. That's a trauma response. My body remembers what goes on in that office. And so it's responding whether I like it or not. And so knowing that that's a trauma response and knowing what to do about it is so, so helpful. Knowing how to soothe myself and calm myself down. So a lot of different PTSD symptoms can pop up. Fear, I touched on before, just fear of cancer, fear of what might happen, fear of the future, anxiety, I touched on as well. Depression is something else that comes up really frequently as an emotional side effect. And oftentimes in this survivorship phase, which catches people off guard because they think, you know, if I was going to be depressed, wouldn't I be depressed when I was diagnosed? Why am I depressed, you know, later down the road? But it's very common for depression to pop up later. And just good to know, I mean, these are really normal things. This is not abnormal to experience some of these things. For people that have an advanced cancer, metastatic cancer, learning to live with chronic illness or forever treatment, they call it. I've heard that a lot in groups that I've run, you know, just adapting to the reality that you're not taking a medication for 2 weeks and then you're done. You're on medication or you're on some kind of treatment plan ongoingly for the rest of your life. And that comes with side effects and it comes with other things. So really learning to live with this new reality of I don't get to go back to normal. I have this forever treatment that I'm facing. Another thing I added in there, coping with mortality. We all know that we're going to die someday, but what cancer does is kind of brings it to the forefront of your mind. Oh my gosh, this is a life-threatening illness. Am I going to be okay? And you're faced with those questions in a way that a lot of people don't have to do. And we live in a culture that's pretty uncomfortable talking about those things. So a lot of times what happens is it gets kind of, just let me put that away. Or the trauma response comes up and it's like, I better not say it or else. But it's there, you know, how do you cope with this idea that we're mortal? Which is a pretty deep and philosophical question, but important to acknowledge, I think, because like I said, we're not always talking about it. I always talk about PTSD just because I think it's so important. We don't have to go into all these things. But there's so many aspects of PTSD, so many things that I've faced myself. Hypervigilance, I mentioned, emotional distress, intrusive thoughts or memories. These things can come up all the time or oftentimes triggered by some kind of external event. So maybe it's something that you're doing in your personal life. Maybe it's a doctor's appointment. Maybe it's a particular treatment. Maybe it's when you take your medication. Some of these symptoms come up. Avoidance, memory problems, sleeping problems. So I just think it's good to kind of take a look at, there's a variety of things that you can face in this survivorship phase and what PTSD can cause. And one of the challenges with cancer in particular is that, it's easier to manage these symptoms when you've had a trauma, like you were mugged at gunpoint and that happened a long time ago and you get to manage it now. There isn't anything that's currently happening to remind you of it, to bring it up, to make it present, moment oriented. So that's a tricky thing about cancer. Like I said, there's all these reminders, all these moments, all these things that can trigger some of these symptoms. Okay, I said I would talk about coping to lighten it up a little. There are ways that you can manage some of these things. I said it earlier, but knowing what it is and what to do about it makes a world of difference. It really does. I think there's often a like crazy making feel about it. I don't know why I'm feeling this way. I don't understand, or isolation in it. So really understanding and knowing how you can help yourself is useful. So coping. Some of the ways to cope with anxiety, meditation, deep breathing exercises. I have one on here. I don't know if you guys have heard about box breathing, a fairly simple and structured breathing exercise. What I like about it is that you can do it anywhere. You can do it in a crowd. You can do it in a waiting room. Nobody knows that you're doing it. It's all in fun. And it involves, the shape of a box. You inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds. And you can do that 2 times, 3 times, 10 times, whatever you need, that can really calm that anxiety, either in the moment when something's happening that feels triggering, or just generally doing that on a regular basis throughout the day, every day, to regulate your nervous system. Can we try this once together? Are you guys game to do this once with me? Okay. I will guide it. Let's do 2 so that we can get one leading into the other. Okay, if everybody can just kind of sit up a little bit in your chair, feet on your brain. Yeah, relaxed arms at your sides. Here we go. We're going to inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. Inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. That's it. I don't know if you can just even pay attention to what's happening within yourself before doing that, after doing that. Really easy and accessible strategy for anxiety. You're feeling anxious. Do it in the moment, do it proactively, regularly throughout the day. Seems simple, but I'll tell you what, it makes a big, big difference for these symptoms too. Let's see, PTSD. I talked a little bit about hypervigilance coming up as a PTSD symptom. Like, oh my gosh, what is that pain? What is that thing? It can come up in the waiting rooms, like I said. It also can mask itself. And I better appreciate every day. Better appreciate every day, or else I'm gonna miss it. That kind of pressure can be a hypervigilance symptom. And a way out, if you're noticing yourself in that place, is through labeling. This is just my trauma response. That's all that this is. And grounding, which is connecting to your senses. So to make it really simplistic, I have this in my hand. I could just connect to this remote. Hold it. How does it feel? Is it smooth? Is it rough? Does it have any other features on it? Is it warm? Is it cold? What are the colors that I'm looking at? Pull you out of those symptoms. Or something in the room using your sense of sight. You know, you could look at a picture on the wall over here and start to describe it to yourself. It's square shape. The colors at the top are white. It's got diamond shapes within the structure. It's got two lines in the center. And that's actually a ground, it's a technique for managing that system. And another one that I think is pretty easy to access. You could do that anywhere, anytime. Modifying activities. That is something that I talk about that I had to do for myself, as well as talk about a lot in my practice. Making sure that you're still accessing the strategies that you really like, but accepting the fact that you need modification. So if you really love to hike, you live on the Central Coast, it's beautiful here. You really love to hike, but you don't have the stamina for hiking anymore. You can't hike as far. You know, maybe you just go down to the water, you go down to the ocean, you walk where it's flat, you take a trail that's flat. Or maybe you don't have the energy to do that. So you sit in your car and you look outside at nature, you sit on a bench and you breathe the fresh air. But really learning to modify what you're accessing that helps support you. That maybe the sense of identity, this person who I was, you know, I can't really do what that person used to do in all the same ways. So how can I access the things that are important to me, but modify? I said taking good care of your whole self. I think what also can happen is you get kind of pigeonholed in one particular thing. For example, nutrition, maybe. Like for me, I know for a full year, I didn't eat any sugar, not a bite of sugar, because I was convinced sugar will kill me and I will not eat sugar ever again. And it was just one thing. I was like, I can control this one thing, so that's what I'm going to do. You really want to look at your whole self. Sure, nutrition is one aspect of that. How can I feed myself nutritious, cancer-fighting foods? But how do I also, you know, make sure that I'm getting rest? How do I also get exercise? How do I also take care of my mental health so that I'm not in a place of worry all the time? How do I meditate? How do I rest my mind? So that you're tending to all these different places, making sure you're getting sleep, that you're getting food and rest, you know, that all of these things matter and not just beelining it for one particular thing. Your whole self matters. The last thing I put in there is expressing your thoughts and feelings openly and honestly can be a challenge. But finding a place to do that, whether it's your worries or thoughts about mortality, or just, you know, positive things or things that are going well, really finding a place to express that. And it can be hard sometimes to really express the harder things to our loved ones. We don't want to burden them. We don't want them to worry. So there's other platforms for that, you know, therapy, journaling, other ways that you can really express it's okay to put it out there. And if you have that thought of, oh my gosh, I shouldn't say it or else, you can recognize, oh, that's my trauma response. It's okay. It's all right. I can say it. I can say it's important for me to say it. It helps for me to say it. And actually shining the light of day on it, you tend to move past it. Like, oh, I said it. And I don't have to think about that. So really helping yourself to find healthy outlets for you to talk about what this is like. And I know in the survivorship phase, oftentimes, you know, the helpers and the people that really rush in to support you can fade out a little bit. So making sure that you have support in other ways and advocating for that as well. Yeah, I did have one more slide on grounding, but I think I'll pull it up just to show you what it is. Another grounding technique, connecting to your 5 senses. Really easy to manage, to remember. 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. Anytime you're recognizing, I think this is a trauma response, or I think I'm really anxious or activated, or my body is responding, this is a really good way to calm yourself down fairly quickly, brings you back to the present moment. So just wanted to give you one last little nugget. That's about it for me. Thank you. My name's Holly Taylor. I'm a registered nurse, but I'm really going to take this more from my personal journey and then more from a nursing aspect. Because I also, besides a nurse, I'm a daughter, I'm a sister, I'm a mother, I'm a wife, and I'm a friend.
I was diagnosed, which button do I push, the arrow?
Yeah, there.
Okay. I'm not tech savvy. So this was me and my family 2 months before I was diagnosed. My kids were 6 and 9 at the time. I also had an aggressive form of breast cancer. There was nothing in my family history. It was a shock to everyone, even my doctors, when I explained I have a lump, what's going on. And turns out I had a lumpectomy. I started chemotherapy, and then they sent me for some genetic testing, which turns out I have a BRCA1 mutation, which then led into a double mastectomy, and then eventually radiation, and then a hysterectomy. And that's kind of where my journey went. Now what I do. Told you I wasn't tech savvy. Oh wait, I found the right screen. Okay. So I started this with C, the big C word. Nobody likes the big C word. So during my diagnosis and treatment, the nurse in me thrives for the knowledge. Like I have to know things. What's going on? What am I experiencing? What does it mean? What's the science behind it? The internet, however, can be a very bad dark hole. I found that often I would go there at night while everybody was sleeping, which is a really, really bad idea. So I had my general surgeon at the time was amazing. And he said, I used to be an OR nurse, I'll throw that in too. So I worked in the OR at the time and worked very closely with my general surgeon, who was also a very good friend of mine. And he at the time said, Holly, when you're looking at the statistics, why do you have to assume you're going to be on the bad side? Why can't you be on this side? And I really took that to heart and always had to kind of refocus. So instead, what I did was just learned as much about it as I possibly could. I learned all the types and subtypes and treatments and surgeries and just kind of took that knowledge. I was lucky enough to find a support group that was an absolute godsend to me. They called it the Young Survivor Group. We were all under the age of 50, all different types of cancers. But it was great to have these people who were this beautiful light as to, you can get through this. We were all in different stages of where we were at. So it was great to have somebody to kind of help you go through the treatment when you're not feeling so good from chemo and, or I have these dry lips or my taste is funny, and giving each other pointers as to what might help you get through that, as well as the emotional support. And somebody who you can see is on the other side of that now. Like that's what I really got the most from it. Is I remember one time asking one of the ladies, will there ever come a day when I don't think about this every day? And she said, yes. And I remember years later going, oh my gosh, I finally hit that point. I finally hit that point where I'm not thinking about it any day or every day. So huge part of that during your treatment, everything is finding your support system. Some people don't like support groups, and that's okay. So maybe your support system is just a good friend. Maybe it's your significant other. Whatever works for you, you really need that support. It's just really important because it is hard. It's hard, like I said, dealing with your own mortality. I mean, maybe you all are better than I do, or I was, but when I heard it, I was sure that I was going to die in 2 years. That's what was going to happen. And I just had that stuck in my head. And it took, going through everything and talking to people to get over that. Taking care of yourself. I also did what Lindsey did. I went on no sugar, no red meat, no alcohol, I'm totally, going for it and doing everything that I possibly can to beat this. 10 years later, that has all definitely fallen off. I still try to make some good choices, but I'm definitely back to where I was. And being an advocate for yourself. There's nothing wrong with asking for a second opinion. There's nothing wrong for knowing your body and recognizing this doesn't feel right and asking. I had to set myself some timelines because I didn't want to be the total hypochondriac or cry wolf, because then I felt they wouldn't listen to me. So I would always 2 weeks was kind of my thing. Like, okay, if I still have this headache in 2 weeks, then I'm going to call my doctor. If I still have this pain in my hip and I did have some stuff that persisted that long, and you automatically do go and think, oh my gosh, this is the cancer, it's coming back. I will say I've had PET scans, I've had MRIs. It's been 10 years. We have never found anything else. So, which is great. Let's see if I can not mess this up again. So I had a friend that when I was going through it, and I did horrible on my typing. Oh, I guess maybe the Y is there. Who had gone through cancer also, and she every day would send me a text with some type of little inspirational. Some were funny, some were not, some were too inappropriate to put on here, so I didn't do those. But these were a few of my favorites. And it's so funny, the one about my oncologist. I pay my oncologist big bucks for this hairstyle. I remember being at the grocery store one time, and it was when my hair was growing back out, and I had the pixie cut, and this gal came up to me and she said, "Oh my gosh, I love your hair. Not everybody can pull that off." And instead of saying anything, I just went, "Thank you." When I want to say, "Oh, you have no idea. Like, I didn't pick this." But just finding, I'm a big positivity person. I don't like to go to the negative. It's not saying that you can't always go there or go there every once in a while. So here's just a few more of those. So what I was saying with that about not going to the negative is I had a couple phrases that we used all the time. Like my husband used to call, as I was going through treatment, day tight compartments. And so what he would say that is because I would always spin farther out, like, but what if? And he's like, nope, we're staying in the day tight compartment. What are we doing today? So that was something I always had to remind myself. Nope, day tight compartments, that's where we're at. And then the other one was I read this book, and one of the quotes was, "It's okay to fall apart. You just can't camp there." So I would always, okay, it's okay to cry and have a bad day. And one day I had a pity party. We were going out for a friend's birthday for sushi, and I didn't have any hair, and I was just kind of over that. And you can't eat sushi because it's one of the things they tell you not to do. And so I was bummed I couldn't have sushi, and I actually broke down. And my husband came in. He said, "Okay, I'm going to give you 10 minutes. Let it all out, and then we're going to pick back up and we're going to keep going." So I did. I put my head in a pillow. I screamed, I cried. And then I got myself ready for dinner and went to dinner because you just can't camp there. You've got to move on. So survival after treatment. When you're done with treatment, you're in this really weird place because you've been seeing your doctors. They're keeping a really close eye on you. And then it's like, okay, we're done. See you back in 3 months or 6 months or whatever. For some people, follow-up visits is lab work. Some it's scans. I remember like them sending me out going, "What do you mean? I'm not, like, I've seen you every 2 weeks and now you're not going to see me for 3 months. Like, that's not okay." And you kind of come around that and learn. And I didn't have scans. That wasn't something they did for my type of cancer. So, which was also very strange to me. Like, what do you mean you're not going to look at everything and see and make sure it worked or didn't work? I did do the lab work. I have the BRCA1 mutation. So my follow-up visits now, I still see my oncologist every 6 months. Even though for most people 10 years out, you don't. But because I have a risk of pancreatic cancer, I have a risk of melanoma, colon cancer. So my follow-up is we now monitor for all of that, which I'm fine with. You want to monitor me? Great. So, which means so I've also had colonoscopies at an earlier age than I should have. We've done pancreatic scans. And so that's what my follow-up looks like. Everybody's a little bit different. And then just focusing on kind of keeping your body as healthy as possible. Like I said, I joke that I have some bad habits, but I definitely don't think I went back to where I still really try to make good choices for my body for the best that I can. And exercise, that is where I definitely not good at doing anything. And as Lindsey talked about, because of the treatments, there's things that happen, like I'm already in osteopenia. So I am supposed to do weight bearing exercises. And that's also because I went into menopause at 38 instead of 50 so I have those other things. I worry about the cardiovascular side effects of that. So just trying to do what you can to take care of yourself. Mental health after treatment also, whatever again works for you, whether that's support groups, friends, continuing to see a therapist or starting to see a therapist. Counseling. Some people choose, nope, I'm just going to move on with my life and I'm going to forget that this ever happened. Even though you still have to go back and see your oncologist, there are some people that just, they would prefer to pretend that this wasn't part of their life. And if that's what works, that's fine. If that's a healthy thing that you're doing. One of the things that has really helped me is helping others. So I continued to go to our support group well after I was done with my treatment because I got to be that person that those people work for me. I got to be the light of, I'm past this, this is what I went through, how can I help you? The administrator at that time would call me, hey, I have this person that has the same kind of cancer that you did. Would you mind if I gave them your phone number? Absolutely. I have friends that I've done that for. I just kind of looked at it as maybe that was my calling. Maybe that's why I had to go through this, was to help somebody else. So that's been a huge part of my survival after treatment, is being able to do that. And like I said, just so offering that support. And then just some closing thoughts. Cancer will change your life. Sometimes it's in a beautiful way, and just always to remember that everyone's journey is not the same as how you choose to, you know what, I messed up on that too. Sorry, I am really not tech savvy. Every journey is not the same as yours, is what I should have said. And their journey is, you know, when you look at things, you'll look at somebody's and go, oh, well, that's going to be me. No, that's not the case. Everybody's bodies are different. Everybody's, the way they handle things is different. So, but your life will be changed forever. And I feel through it, I definitely saw more of the great things in life, learning to appreciate more things. Whenever people talk about getting old and how much they hate birthdays, I'm like, oh my gosh, birthdays are a blessing. Like, and I really believe that. And so I have to always remind people, no, because you're here. To celebrating every birthday is a blessing. It's not a, who cares if we're getting old? That's great. That's, I mean, it's a wonderful thing that we're all getting old. Just make sure I wasn't missing anything else that I wanted to talk about. Sorry, I'm not as eloquent of a speaker as Lindsey is. I think that was kind of it. So yeah, so it's the survivorship when you're going through everything, and then the survivorship when you're done with all your treatments. And like I said, my biggest thing is try and be as positive as you can and deal with what you can and ask help. Advice.
Thank you. Hi, everybody. Good evening. I'm going last. Rob Johnson is my name. I'm a radiation oncologist here in town. I come from, though, anybody who's ever seen me in the office, which many have, I am the most ineloquent by all, there's not even close, of the three of us today. And it's because I grew up in this little tiny farming community right here in North County, San Diego. And this is a Google Earth shot of the house where I grew up, and my mom still lives there. And these are all persimmons. We're persimmon farmers. This used to all be, not that side, but this used to all be persimmons. And then right here are pomegranates. See the bushier looking ones? Anyway, growing up, I was into plants. I liked plants. I majored in plant biology in college. I always wanted to work with plants. It was not easy jobs to find working with plants, really. Then, long story, after I graduated from college, I worked at a pharmacy for a while my future wife was in graduate school on the East Coast. During that time, or shortly after, her mom died at age 52 of lung cancer. She had never been a smoker. That experience, plus some of what I did through pharmacy, I actually had an interest in maybe going into medicine. It was kind of a leap of faith for sure. I had to go back to Cal State San Marcos, which is a university in North County, San Diego, to take some prerequisites and just get back into the school things. I'd been out of school for several years and got really lucky to get accepted to University of Cincinnati College of Medicine. Towards the end of my third year in 2006, I was 31 years old. My wife and I had just within 2 months before that, started trying to have a family. I was rotating through surgery, which I absolutely despised. And I was already applying for residency. It's the end of third year is when you apply for residency spots. And I wanted to be a primary care doctor. I wanted to go into family medicine. And I felt a lump in my right testicle. Out of the blue, right? No pain, no nothing else. Kind of an incidental finding, not diligent enough to have been doing self-exams, but I felt it. I knew that was something I couldn't ignore. I knew too much from medical training. The way you work that up is you do an ultrasound, which was positive for a mass, but with testicular cancer, you don't take a biopsy, without actually doing surgery to remove the involved testicle. But I saw urologists, I saw medical oncologists, they all thought for sure it's likely cancer. Testicular cancer comes in many forms, and you can't tell just by looking at it under the ultrasound. You got to do surgery for that. And it's a fancy term, right? Radical orchiectomy, that just means they remove your testicle. And depending on what type it is, you might need additional treatments. Radiation, chemotherapy, sometimes both. Now you have to imagine I'm in third year medical school. Medical school is an extremely busy time of your life. I really had no time for this at that time, right? Very negatively impacting my family. We were trying to get pregnant. Looking back, 31 seems young, but my wife and I felt like we were kind of up against the clock with family planning. We didn't know how successful we would be. We didn't know how long it would take us. And remember, I'm from San Diego and I'm in Cincinnati, 2,000 miles away from family and support. Not to mention it was impacting my professional life too. I'm trying to complete medical school, applying for residency. If something with my illness would have taken me out of school for a period of time, then I would have had to basically fall back to the next graduating class. There's no way to graduate late or that sort of stuff. I would have missed the window for residency application. Now, also, as I'm thinking about this, I've not had surgery yet. Either chemotherapy or radiation can cause infertility. So as a young man, they said, you should go do sperm cryopreservation, which is you give sperm samples and they freeze them. This was the most humiliating thing for me because I was where the sperm bank was in the hospital while I was rotating as a surgery student. So I would have to scrub out because you have to make an appointment, to go do that. So I would have to scrub out from a surgery case. And the attending, we call them, the teaching doctor, would say, where the hell are you going? And I had an amnesty from the clerkship director just to say, I got something to do. And so then I would go down and you can imagine what that actually entails. And then I would have to come back, scrub back into the case. Nobody knowing but me what the actual issue is. Okay, so then I have my surgery on June 6th, 2006. It was a Tuesday. I still remember. That's pertinent here only because I did not hear the details of what happened, what the pathology was or what that meant to me until the following Monday. I was hoping I would have heard before that, because I spent that whole weekend just ruminating and worrying and all this kind of stuff. I get the call. They tell me it's cancer. That's the bad news. But the good news is, it's the best type to have, very treatable, pretty much a normal life expectancy prognosis. My initial response was relief that, of course, I had the best type of cancer, but also they removed your testicle. And if I had not had cancer and they removed it for nothing, that would have bummed me out. So I have this weird psychology going on. But of course, you're human. After that relief, I feel shocked. Why me? I'm this one there were 400 male medical students at the University of Cincinnati. And I was that one, you know, and that took some time to get over, that concept of, I knew enough to not think of it in terms of what I did wrong and things, because these things can be sporadic and oftentimes you've done nothing wrong. But still, I went through something like that. And then much like we had shared before, this picture was supposed to be bigger. But my initial response was, okay, well, I'll do whatever it takes to survive. I don't care. I don't care what it does to me, as long as I'm going to live, I can do it. And I think that's pretty natural. So again, I met with the oncology team afterwards. At the time, for what I had, the standard was to take radiation treatments, although there was an evolving concept to maybe use chemo. But I took radiation in the summer of 2006. Now, by this time, I'm starting to have an interest in maybe being an oncologist, because I'm thinking something like this happens to me at this stage of my life. Maybe I ought to listen to that. And maybe there's meaning to it. Some more ridiculousness. While I was receiving radiation treatments, I was rotating in radiation oncology. I knew nothing about radiation before I got into this. It's a really small specialty. It can be intimidating. There's a lot of physics and all this kind of stuff. But if you don't know much about it, you know, but I'm going through rotating in radiation oncology, and then I would excuse myself in the afternoon, go get a radiation treatment, then come back. These people knew what I was going through in radiation and very supportive. Now, with radiation treatment, radiation carries potential to mutate tissues it interacts with. And a really sensitive thing to the impact of radiation, is sperm. So having had radiation treatment, and remember, we were family planning at the time, I met with several people, my own radiation oncologist, the chair of the radiation oncology department at the University of Cincinnati, and even a reproductive endocrinologist, so basically a fertility expert, and said, hey, I just had radiation. Should we wait, or can I just immediately continue with family planning? And they said, well, nobody really knows. Wait 6 months, we should be fine. Thankfully, I had lots of support, by the way, from my school, and I did not have to take a break. I got lucky. I changed my path to radiation oncology really late in the game. And at the time, radiation oncology was probably the most competitive specialty to get into in medicine, right? And I was a good student, but not a student who had planned on trying to get into the most competitive specialty there was. So I'm sure my own